60 Minutes Overtime.
What began as an outbreak in China has become a worldwide epidemic, with more than 100,000 cases in more than 90 countries. There is no vaccine or specific drug to treat it. Instead, there is hygiene and quarantine.
I'm Dr. Jon LaPook, and a year ago, we reported the very first 60 Minutes piece on the pandemic.
Camera marker?
Is there any reason to think it's not going to spread widely throughout the entire United States?
It depends on the ability to do the kinds of public health measures that could have an impact on the degree to which it spreads.
When you think that a year ago, we said that as many as 20 people have died, and now it's more than 500,000. It just takes your breath away. I think at the beginning of this, it was hard to take it seriously for some people because they didn't know anybody who had gotten sick. They didn't know anybody who died. And has that ever changed?
It was the first Monday in March when we realized we really needed to get going and to help tell this story to the country.
Denise Schrier Cetta was one of the producers I worked with on that very first piece.
I remember reporting that story that week and realizing that it was possible that the world was going to change pretty dramatically for a long time.
The scariest moment for me in reporting was in that very first story. You knew that the virus had to be out there. You couldn't see it, you couldn't hear it, it was invisible, but you knew it had to be out there. And so we went to the emergency room at Johns Hopkins and we were talking about where do we shoot.
But as we were on the ground, we realized that we had to take a step back.
This is our incident command center.
Take a deep breath and realize that this was an emerging pandemic and we couldn't just take that as far as we wanted. And fortunately, Dr. LaPook was the correspondent and he had a great perspective on that.
So I kept our team back, away from where the sick patients were. There were times when you just can't take a chance.
So at 60 Minutes in every piece, we always scrutinize every single word. And one of the words that we debated as a team in the March story was whether or not to use the word pandemic, because the WHO had not called the coronavirus outbreak a pandemic yet.
Dr. Tom Inglesby is the director of the Johns Hopkins Center for Health Security. Do we have a pandemic now?
I think this disease meets the definition of pandemic. We have cases on all continents.
It was only a few days after our piece that the World Health Organization officially said, okay, this is a pandemic. But really, by the time we aired, it had met the definition of a pandemic.
Hello, John.
When you have a story like this where there are so many unknowns, you want to turn to real experts, people who have been through other infections, other situations where there was a lot of unknowns. And of course, Dr. Anthony Fauci was the obvious choice.
Some people have been worried that you've been muzzled.
I'm not muzzled because I'm talking to you.
Exactly, you're right here.
Okay.
He always says, sure, I'll talk to you. I just need to get clearance to do it. And it looked like very soon before we were supposed to do the interview, we were off. Fortunately, with the help of some people high up in government, we were able to get it back on again.
I think a lot of people are very interested in the relationship between the scientists and the administration.
Right.
And specifically, if President Trump says something like at the beginning of February, like, we think we have it under control, you're in the room. Were you able to
I push back, of course.
It certainly was a clue very early on that it was not just open communication. And I think we've learned that there was an attempt to sort of control the message.
I think what's been so unusual about reporting on the pandemic during the last year is that it has impacted everybody. Similarly to 9/11, but even more so, this is a tragedy that has blanketed the entire nation and the entire world. So I think it's unlike any story most of us have ever covered.
At the beginning of this pandemic, I said, look, there's going to be a beginning, a middle, and an end. And I really do think we're at the beginning of the end. We have a lot more at our disposal now than we had a year ago. We have these effective vaccines. We have masks. But we have to understand that the battle's not over. This is a time where everybody's got to pull together because this pandemic is not going to be over for anyone until it's over for everyone.